everyone for attending the ACCEL CTR Innovative Series Seminar today, Innovative Discovery Series Seminar today. You may already know that October is Health Literacy Month, so we are thrilled to have Greg O'Neill from Christiana Care to talk about the skills of teaching back, which is a very important issue when providing care to patients. But before I introduce our speaker, let me go over some housekeeping issues. We continue to provide CME credits for our Tech Talks and our ID series presentation. We will distribute this information via email to those that registered for today's event. But if you did not register prior to today's talk, you can still obtain CME code information from Deborah Rees, and her email address will be posted in the chat box today. Our upcoming events on November 3rd, we have our own Dr. Zugui Zhang, who will give us a tech talk about introduction to mediation analysis. And on November 10th, we'll have another ID series seminar from Mary Misdaffer from University of Delaware. We'll talk about radical welcome in healthcare settings, increasing healthcare utilization and health equity. So you really do not want to miss any of those. So November 3rd, a tech talk, and November 10th, an ID series seminar. So again, I'm really thrilled to introduce Greg O'Neill, our speaker today. Greg is Director of Patients and Family Health Education at Christiana Care, and as such, he leads the strategic plan for patient educations and health literacy initiatives, and has developed a team of nursing professional development specialists who champion health literacy best practices system-wide and support all patient education initiatives. Greg received a Master of Science in Nursing from University of Delaware, and he was nominated for multiple awards, the last one in 2020 by Delaware Today as a top nurse for volunteerism. He is a sought-after speaker and has given regional and national presentations on topics related to health literacy. So again, thank you so much, Greg, for sharing all your knowledge and expertise about health literacy.
Thank you. I'm happy to be here. It's really a pleasure for me. This has become one of our standing Health Literacy Month celebrations, is to come and join you guys for one of these. So thanks for having us back again. Again, thrilled to be here. I'm going to go off video while I'm giving the presentation, but I'll come back on for questions at the end. I think questions towards the end of we have a pretty good presentation lined up for you guys today, so let's jump in. All right, I believe this is working now. All right, folks, so thank you for joining us again today. I don't know if most of you interact with patients or families or community members to where these teach back skills would be really applicable. But if you don't, feel free to apply them to your family, children, maybe even coworkers. This is an opportunity really to understand something important about communication. That's really what it comes down to. So this presentation is part of our Teach Back curriculum here at Christiana Care. And we offer this up as really a second course to folks who have already had a first encounter with Teach Back content. So some of this will not really review the basics of Teach Back. We'll touch on it briefly, but we really want to dive into the advanced skills so that folks can be thinking about all the different aspects of Teach Back, not just the sort of simple things that might come to mind when you first hear about Teach Back. So I will jump into the presentation. Like I said, I will off my video for now. And can you just confirm that you're recording?
I am.
Okay, great. All right, here we go. Teach Back, what are we going to talk about today? This is really about helping our patients, family members, and community members understand their health. That is the goal of health literacy in general. Make sure these transitions work. This presentation you're going to see today was developed by someone on my team. And we offer this up as actually a web-based education internally, but we thought it would be great to share this skill set with a broader audience, so that's why we're bringing it to you guys today. So that said, this has been approved for CME. We don't have any disclosures to share, those of us who developed this program, and it has been approved for CME by the Medical Society of Delaware. So there's our disclaimer for that. All right, so what are we going to really do today? We want to make sure that folks recognize that there are advanced skills to teach back, so that if you've tried it, if you've encountered a little content, you know a little something about teach back, maybe this will give you a little bit more context to help you refine those skills. Oh, I can see she's got animations in here I have to be mindful of. So we want to make sure folks can really demonstrate and use nonverbal, paraverbal, and questioning skills that promote trust and respect. And we want to make sure we have folks are using the appropriate supportive resources when trying to explain health information that might be difficult to understand. So to just kick things off, let's think about a statement by Albert Einstein: if you can't explain it simply, then you don't understand it well enough. As medical professionals, we need to understand that there are many complicated aspects to medical care that we need to understand as healthcare professionals, but generally does not benefit patients and families if we're not communicating that in a way that they can understand. So let's not make things too complicated. It's fine for us to understand it in all of its complexity, but let's make sure we're sharing it in the best way for patients and families. So like I said, this is kind of a part 2 generally in our curriculum, picking up where we left off from our first course on the sort of basics of teach back. And if we have folks who do interact with folks, have you tried it? Have you practiced your teach back skills at all? So jumping in here, let's make sure we explain information clearly, right? This is making sure people explain things back to us in their own words. If that's not happening, then there's really no way to confirm that understanding has been achieved. You can do this at any time with any information that you deem important enough to confirm with patients. There are many reasons that we might try to use teach back with folks. One of the biggest ones that we share with folks is that 1 out of 3 adults in the U.S. may have trouble understanding health information. This comes from a national study. There are emotional barriers that get in the way for those who even have some good health literacy, so it's a flexible target. And it's been recommended by most reputable organizations throughout the country. Everyone has agreed that this is a good idea, and so now we really need to make sure that folks are implementing it in practice. And the evidence shows that it does improve outcomes. And you'll see over on the right-hand side there, another extra reason to do this is patients actually appreciate it. So one of the things we'll do today as we move along through this presentation is sprinkle in some of the why we're doing this. So this is some patient feedback. What better way to land on why to do this than to hear directly from patients, right? So I won't read all these quotes to you, but patients really do comment on this when they feel the difference in care that happens with teach back. All right, so real quick review on the basics. It's about explaining key points, right? You want to limit it to a certain number of points that you're trying to share using plain language. You ask patients to explain things back in their own words, and then you re-explain if you didn't get back what you expected, right? So this doesn't sound like rocket science, but it can be a little bit different to change the way that you communicate and the way you speak with folks. So really thinking about those basic skills, it's that chunk and check over and over and over until you get back what you expected to. All right, so one of the things in the advanced course we want to cover is what kind of barriers and challenges are we going to run into here. So common concerns, How did it go if you practiced? If you're someone that's already heard of Teachback and tried it, you might say, well, there's not enough time, right? That's one of the common things that we hear from folks. Not enough time. It doesn't necessarily feel natural. If you have to change the way that you normally ask questions, maybe it's not necessary. You think that people are understanding just fine. Um, those are all common concerns that we hear, and they can all be addressed, including folks feeling like it's demeaning. Sometimes people think that you're sort of talking down when you're doing Teachback, but that is not the case. I would reframe that to say you're making sure that folks really understand the important information that you're trying to give them. So just to share a couple comments here from providers as well. We have not only gotten patient feedback that this is valuable, but providers have found it valuable as well. This provider shared that, getting additional questions really helps, and Teachback can prompt that, and it might help move your discharge along a little faster if you can cover those key points and make sure they understand. And then it can save a lot of future time, right? So if folks are saying there's not enough time to do Teachback, we really have to think about, how much time are we going to spend later if they don't understand what's going on now, right? So just focusing on that little aspect that it takes a couple of minutes to do Teachback is not fully understanding the big picture, that it can save you a lot of time in the long run, right? And especially if you're focusing on the most important details for that person to know, and really confirming that they understand what you need them to know. All right, so Teachback is really something you should only do for the most important priority information. This is not something you want to be doing all of the time with all information. That will contribute to volume overload, which we know that is an issue for patients as well. So this might make you wonder, I have to give a lot of information to my patients. It's required by law or regulations, or they really, one thing we've heard is they need to know all this stuff. Well, it's not going to do them any good, and the real risk is that the patients will not understand any of it, right? So we need to be choosing wisely. We need to be very careful in prioritizing for the patient and confirming with Teachback, because while we think we might be avoiding a regulatory or legal risk or something like that, we might be creating a bigger one by trying to communicate too much information. So another barrier, it doesn't feel natural. A lot of times folks' default is, do you have any questions? Right? That's a yes or no question. Very easy to answer, but also very easy to hide behind if you don't understand something. So it does take a little bit of effort to change the words that you use, right, in your communication. But with practice, you can find some key statements or things that you find really bring the information out of patients in their own words, right? And this can help you feel like it's working for you and your patient. You can both feel better about the communication that's happening. All right, so another barrier is, how you do this will take a little bit of effort in terms of practicing, right? The first few times you do this might seem a little weird, or your timing, you have to figure out, what things to prioritize or how much time it's going to take you to do. But there have been studies that show that that doing Teachback is something that will help you feel more confident in the responses you're getting from patients, and that they can actually manage their care. In this call center, there were a few hundred encounters that were studied, and nurses felt like the Teachback was really helping patients understand, and the patients felt better about it too. Another patient feedback comment here, where the person actually says they had me repeat back what I needed to do. And this really can improve the experience for patients. They can walk away feeling like you really care about them if you took the time to make sure they understand the information. We probably all have anecdotes of ourselves or family members who leave an encounter and say, I don't know what just happened. Can you tell me what that was about? right? So we want to make sure that's not happening. Another barrier that it's not necessary. A lot of folks will kind of say, my patient understands this. I've shared all this stuff with them, but they get it. They're up to speed, right? That is, I think, a little bit of overconfidence in people's ability to navigate information, right? In order to really hit things home, we have to be confirming that. We can't make that assumption. So, teach back is the way to do it all, right? You can assess someone's understanding right out of the gate. You can explain key points and do teach back and change your intervention and actually, sort of re-describe something if you need to in order to achieve true understanding. So it's an assessment and an intervention all at once. There's a study that we looked at having to do with production effect, right? And this is like doing something kind of novel can really help you in cementing the information. So actually saying things back in your own words is a way of cementing the information into your brain, right? It's more engaging and it's going to help solidify the memory around that information. So that's pretty cool. Another patient feedback. This is, again, someone stating in a comment that they were asked to repeat back the treatment plan. And this, if someone's taking the time to put a comment in like this on a survey, I think it shows you that it really resonates with folks and improves the experience, which of course we're all trying to do as well. All right, so another barrier. We're moving quickly through these, so hopefully you're keeping up. It's demeaning, right? We don't want it to be like a test of the patient, right? That's not a good experience. So we have to be careful and thoughtful about how we frame this conversation. We don't want them to just parrot back everything we said. We want to truly see if they understand what we're trying to convey. If we do this with a humble approach, right? This can help us make sure that we're coming across in a way that's very caring, right? And we're taking responsibility. I want to make sure I did everything I could. Can you tell me what you got from this conversation? So that's really the way to approach it, so that everyone comes away feeling like it was a valuable conversation. All right, another one. So this goes kind of to the demeaning point as well. We need healthcare to be a team sport, and that includes the patients, right, and the families. And they won't feel like we're demeaning to them if we're asking them to repeat back their care or their treatment, if they feel like it's part of that team sport, right? We want folks to really feel like they're included in the plan, that they're an important part to making their health improve. All right, so another patient feedback here. This is a pretty simple one, just the feeling that this patient got when they were asked to explain things back, really made them feel like the provider cared about them. All right, so how do we address these barriers, right? This is about improving your practice. We're going to have to do something to make this happen, right? It's not going to just happen organically. So if you apply some of these principles in your care of patients, you will see things like your patient experience scores improve. And we've had that happen here, where we had some folks in our heart and vascular service line really apply these techniques, and they saw their scores rise dramatically in just 6 months. So this can have a very real trackable effect on folks' experience. Things that we can be doing: describing the patient's condition in their plain language, asking the patient to describe what they understood about their condition, providing supportive resources and links to websites, maybe even some imaging, right? Images, pictures, and videos. Including a family caregiver is extremely important. I'll talk more about that in a little bit. But the more people you can educate, the better. And then asking folks, what do they think of this plan? And what are your concerns? And kind of recapping what are your takeaways in your own words? What would you highlight from this discussion we've had? What's important to you? Those things really are validating for patients. All right, so how can we improve our skills? All right, now that we've talked about some of the barriers, let's talk about how you can skill build. That's the point of this presentation today, is to give you some new skills and things to think about. So we already know the basics, right? Assess or explain key points, get them to say back in their own words what they think, and then redo it if it didn't work well. And now we want to kind of go to the advanced level, which is our non-impaired verbal skills, questioning skills, and supportive resources to help us reach success. So let's talk about some little things that can help establish trust. Very important that we're using a caring tone of voice and volume. Sitting down is often something that really puts people at ease, so you're at the same eye level. You want to make sure you're talking to them as a partner or a teammate, so you kind of avoid that top-down communication. Listening is going to be key, making sure they felt heard. Maintaining eye contact, like I said, if you can be on the same level as someone, that is a great skill. And adopt a comfortable posture, like I said, like sitting. And make sure that you're attentive, right, and not distracted by your phone, your computer, other things like that. It can be hard to do that in a modern healthcare setting, but people really notice when they aren't the center of attention in these interactions. They want to tell you their life, right? They want to talk about their health and their story, and that may very well have a great impact on the treatment plan and the next steps for them. So it's important that we hear from folks directly what's important to them. Just another bit of the why here as to why this is important. This person said that the doctor takes time to clearly explain things and find out what the concerns are. And again, this can have such an impression on people. This was her first visit, sick, and coming back for another visit, she moved her whole family over to this practice. So this is something that can impact the long-term plan and interaction with our health system as well. All right, so moving to questioning as a skill set. Do you have any questions? I already said that is a yes and no question. We don't like that. We like open-ended questions, right? We don't want folks hiding behind that yes and no answer. See, nope, I'm good. But if you ask what questions do you have, most people are going to have questions in a healthcare encounter. So let's assume that they do and ask them what questions they have, gives them a chance to think about it and respond appropriately, right? Have them fill in the blank. That's the key. And if you kind of rattle off a bunch of quiz-like questions, tell me what the side effects are, what's this medicine for, that might be a little bit overwhelming. So maybe what works for you best with your patients is to kind of ask an open-ended question. Tell me about your medicine. When you go home, how are you going to explain how this medicine works to your family? Something very general like that. You might find out if your messaging really stuck, or if you need to circle back on something. So questioning is a really key asset in terms of trying to find out what someone knows and where the gaps might be. All right, then there's other ways to say it. This is a big one for us and our team. We are constantly harping on reducing medical jargon. This really benefits almost no one from the family and caregiver side. It is always easier to ramp up your specific communication if folks are really interested in the details and medical information. You can always ramp it up. But if we come in with using a lot of jargon right out of the gate, we're going to miss most of the people. So that is a best practice that we promote in all of our work. All right, involving other team members. This is another key aspect for how to do this well. You can imagine if there's one person on the team doing teach back, that's great and good for that person. But if the whole team is doing it, you might really have more of a coherent message for the patient and family that feels like the whole team is involved, right? And if you are having trouble with a particular encounter, feel free to use those around you who might be more skilled in teach back or just have a different perspective. Bring in some language services friend if language is a challenge for this encounter. There are things you can do to not have it all be right on your shoulders, more of a team approach. And then supportive resources in terms of the actual education content that we like to share with folks. There's a lot of different ways for people to remember information. So it could be pictures, videos, leaflets, books, websites. Really find out what is best for your patient family members, and then utilize that in the best way that you can. You can kind of use teachback off of those tools, right? So you don't have to necessarily have everything come directly from you. You can use some reference materials and teach back on that, right? So an advanced care planning shared decision-making tool is an example of this. You could have someone walk through that and then circle back with them on teachback to see what kind of questions they have. Another aspect of supporting folks is the CARE Act. If you don't know what that is, you can Google it, but most states have now adopted some version of the CARE Act, which requires us as acute care healthcare facilities to educate an additional caregiver specified by the patient, right? And the idea here is that most folks in a healthcare encounter are going to be stressed or ill. It's not a great time to be educating, and they're not going to remember everything that we need them to. So if we educate a caregiver designated by that person, we just increase the chances that what the information we're trying to communicate is going to be followed once they leave the encounter. All right, so again, someone to lean on. Most people are going to need someone to help them navigate healthcare information. And expecting folks to come through a healthcare encounter and retain everything that they need to know when they leave is a really big ask, right? So let's remember that most folks lean on someone after they leave. All right, let's talk a little bit about getting folks to where they need to be in terms of understanding, right? Part of this is meeting people where they are, right? The same cookie cutter approach may not work for everyone. So this is part of, especially now with our focus on equity and reducing disparities, we need to really be assessing what information people need, how they need it, how they can best process information, what kind of barriers do they encounter frequently, and maybe we can address those in a different way. So just to be mindful of the fact that what you do for one person doesn't necessarily work really well for everyone, right? So there's different ways to sort of think about this. If you were giving directions to someone, you could give a very analytical sort of layout of how to get there, right? And if you can take this analogy to health, we could clearly explain things in very complicated fashion. How to improve someone's health, right? But this might miss the mark, right? We also want to, we want to present things in a way that is going to be most useful to people and provide them with the resources that they need to connect those dots. Similar is how a lot of folks might use a GPS to get where they're going. They might really appreciate having some other tools like websites, videos, and materials to help them navigate the complicated information landscape. So another aspect to just touch on, I've talked about it a couple of times, is the team sport aspect of this. Using teachback is your assessment of if you've reached understanding, right? And that person is really going to feel like they're part of the team if it's something that you're doing on a regular basis. Now, if you're someone who is in a clinical setting, we need to make sure we're documenting in the medical record. This is another advanced teachback skill because you want to be able to record and hopefully transmit that level of understanding to the next encounter or to the next provider. If somebody really needs follow-up information, we have to be documenting and recording that to kind of learn where everyone is on their learning journey. Like I said, the same information to 10 different people, they're probably going to end up in different spots by the end of that. So a key aspect of that is documentation as well. Again, another little highlight as to why we're doing this. This person actually called out that they were asked to repeat back, right, what they were supposed to do. And for her, she's never been so pleased with a doctor. How many times have you seen that in a patient experience survey comment? So this is something that can be very powerful, not just on the actual health outcomes, but also the experience front. All right, we got some fancy graphics here for you guys. All right, so continued growth. How can you continue to grow in your teach back skills, right? How can you continue to develop yourself and get better and better at this? Mostly it's going to be practice and kind of reflection, but also one of the things that we promote is to be observed. You can kind of do a self-observation after an encounter and kind of reflect on how it went. Did I use closed-ended or open-ended questions? You can also ask other folks to observe you. And this is really where the power is having other folks observe you and getting feedback on how your teach back is going. You can practice with your teammates. We do some virtual training sessions where we do role playing, which is pretty fun and really insightful. I think a lot of folks think they're great at teach back, but once you have some observations with feedback, you find out there's always room to grow. And you can ultimately ask your patients too, like, how did I do? Trying to convey this information to you. Was having you explain it back helpful to you? All of those things can help you assess and continue to learn and grow in your practice. All right, so by observing others, we're helping them, right? It's also going to help us stay more focused on this as an intervention and a practice. So like it says on here, you'll be more mindful of your own practice if you're giving some observation and feedback to others. So it is it's not something everyone is used to in terms of having your encounters observed, but it is probably the most powerful tool that we have in the toolbox. So when you're observing someone, we have some key things here you can look out for, right? In terms of the paraverbal, nonverbal, super important. Was this person using a caring tone of voice and attitude? How was their body language? Did they sit down? Person feel comfortable? Were they using plain language? Was there some jargon in there that they didn't realize? Seems very simple to us, but might be jargon that the patient didn't understand. Did they successfully narrow it down to a few key points and priority items, right? And what was their teach back prompt? Have they found a way to get the person to explain back in their own words? Have they found that phrase that works well for them? And did they take responsibility? It's really important that we don't put all this on the patients and families. We say, it's our job to make sure you understand, using respectful questions, making sure that the person doesn't feel like they're being quizzed. Open-ended questions, I already mentioned that. You can't hide behind an open-ended question, so that's why it's so powerful. Doing the teach back again, teaching again, that chunk and check if they were not able to teach back. Making sure you're using your additional supplemental materials. So whether it's other teammates or content materials, websites, videos, anything that you think might help that person understand can be very important. Including a family caregiver, this is probably right up there. This is probably number 2 behind open-ended questions, making sure you're educating more than one person. And then, of course, documenting how this is going so that from encounter to encounter, everyone on the healthcare team can understand where this person is at in their learning journey about their health. So that was a very quick summary of that, and we're happy to share any of these tips and tricks with everyone. All right, so this can help everyone, right? Teach back is not something that's only for clinical people. I'm sure there are non-clinical people on this call. And it is important that everyone understand it's a general communication strategy. It just happens to also work very well with patients and families around health. Another good comment about why we're doing this, they said right here, they're very good listeners. They asked me to repeat back what I understood they were saying. This led to their opinion of having excellent customer service, excellent bedside manner, and a really good experience. So again, we keep getting these comments all the time. We try to share them internally and really recognize caregivers when they're getting these comments said about them, but also just putting it out there to share with the broader health system that this is something that's very impactful. All right, I think I went through that pretty quickly, so I'm sure we have time left for questions. A couple last things, what does the future look like for your organization, for your personal journey around TeachBack? This isn't somewhat of an advanced course on it. What's going to be next for you? I would say don't make this a one and done. Here's some references from the materials that we use, but I would make this part of your learning journey and one step towards becoming a more proficient practitioner of TeachBack. Hopefully you've learned some things today, and this is sparking some questions for you guys. So let's have at it.
Thank you so much, Greg. This was really, really a wonderful presentation. I learned a lot. Mia, you have a question?
Greg, I agree. Great presentation. I'll speak from personal experience. So I take care of my elderly parents, and I take them to primary care, to cardiologists, etc. And the doctors actually do a pretty good job at TeachBack. But by the time they leave the office and get home, and a day or two later, they've completely forgotten what they were supposed to do. So I'm there and I write things down for them. But I wonder if there isn't plans for maybe giving the written, or you said, there's different types of information written or in a chart or a video or something, of how to move that TeachBack out of just the one-on-one encounter with the clinician into the patient's daily life and routine.
Yeah, excellent question. I know everyone on the call probably has anecdotes similar to yours. I know I do. I go with my dad to his appointments and I write down everything that they say that's jargon. So, and then when we leave, he says, "What was that all about?" So I get it. Two things on that. One is we try to teach anyone who will listen about TeachBack because it is something that can be encounter to encounter. So if someone leaves an ambulatory appointment like you're talking about, but then they get a call from a nurse navigator or from Care VO or care management, somebody the next week, hopefully that person is also doing TeachBack. So if everyone's kind of doing TeachBack along the way, and that documentation also is something that can help track the person's understanding throughout time, that's kind of the ideal state. I will say that the second thing I'll say about that is that we're not there yet in terms of the technology and process really enabling that. So right now we're kind of leaning on the individual practice of practitioners and folks in the sphere to be doing that and trying to keep up with it. And hopefully our EHRs and our other our electronic health record and our other tech companies and solutions will over time find a way to do that and kind of make that more in the day-to-day life of a patient, right? So like if they go to the patient portal, it would be great if there was something there that also kind of helped them in a TeachBack manner. So we advocate for that and we're pushing for that as a team. I don't know that we're there yet, but the foundations right now are using materials and supportive stuff that's appropriate, skilling up on TeachBack so everyone through every encounter is doing TeachBack. If you think about it right now, if no one did that with your dad, no one did TeachBack, you would just go to the next visit and then the next visit and the next visit, and no one is identifying that there's a learning gap there, right? Literally that happened in Care VO. Dr. Tabassum Salam, who's a great advocate for this work, talked about a diabetic patient that Care VO was following. They did an in-depth investigation on why she wasn't following the treatment plan. She didn't understand it, right? So once they sat down with her and were able to she did not have a high reading level. Once they were able to give her the tools and explain things in a way that she understood, her A1C dropped like 4 points in a matter of months, right? So that's the kind of power to move clinical outcomes. Now, scaling that up is where we really need to do the work. And that's going to start with everyone having awareness and skill building for their individual practice. Hope that helps.
Yeah.
Other questions?
Actually,
Usually you can see everyone's fun Zoom picture, but I would just have a bunch
something
of questions.
important that I just thought that I think that you said in your talk, and actually that interesting, like there is some correlation.
Yeah, it's a little difficult to hear you. We have a hard
Can you
time.
hear me? Can you hear me now?
Could you get closer? Yeah,
Yep.
closer to your microphone.
Yeah, I'll turn my camera off so you don't see my face. Okay. There's some correlation between, education itself and learning and understanding health information. But that's not true for everyone. How do you work with individuals, I guess both individuals and providers, to kind of tear down that bias or perception that, if you have an educated person in your room, that necessarily means, of course, they're going to understand all that. Or if someone has, a low literacy rate, that means they're not going to understand.
Yep. That's a common misconception, so thanks for bringing that up. It's not specific to Teachback, but it's in the health literacy best practice work, that the rest of the work that we do. There really is, there's maybe a slight correlation to someone's education level and their general literacy. But when it comes to health literacy, you can have a PhD professor in rocket science come into the ED and not have a clue as to what's going on with this health situation. So it really is not a good gauge, and it's not recommended from all the national resources to correlate anything like that. So really it's bringing that awareness to frontline staff that that's not a good indicator. And the recommendation from all the best practice information nationally is to use universal precautions for health literacy, which means come in at a low level, assume low level of health literacy, because you can always ramp up, right? If you get that person that's firing all these questions at you using medical jargon and they seem to have a really great understanding, okay, now game on. I'm gonna flex my medical muscles here and give them all the great information I have. But if you do that out of the gate, somebody may not signal to you that they don't understand. So the practice is universally come in at a low health literacy level, speak in plain language on simple terms, and then use that as your assessment to see if more detail is needed. Any other questions?
Yeah. Well, I have one question / comment. I guess it must be much more complicated for patients whose English is not the first language, right? And I know at Christiana Care we have a really extraordinary department of interpreters. But how do you recommend interacting, with interpreters when patients do not speak English?
Excellent question. Happens to be high on our priority list in terms of our equity work here at Christiana Care, to connect folks not only with the content in their preferred language, but then, like you're saying, during the actual encounter, how can you do teachback? And it really is through using interpreters, right? I know here our language services department really stresses that a qualified interpreter is really the only one you want to be using. You don't want to be using Google Translate to translate anything. You don't want to rely on family members and things like that. And all that person is going to do as an interpreter is literally just say whatever is being said. So if the practitioner is skilled in teachback and is doing it, that's just going to go right through the interpreter and reach the patient. So you don't have to do anything special for those encounters with folks who struggle with English, other than know that they struggle with English and do something about it, right? Don't just kind of brush over it. Don't assume that they're understanding stuff. You can't do that confirmation without an interpreter if they really need it.
Thank you. I think Amy had a question. Amy, you have a question?
Yes, can you guys hear me?
Yes.
Yep.
So I think this is really great. Thank you very much for this presentation. We've been using it, Teach Back, with our research consents. And I think that the most, the biggest change that I've made that's had the most impact has been shifting, and we've been doing this for years since I first heard about this, shifting to saying, what questions do you have, rather than, and I know you brought that up too. I can't say how important that is. It's incredibly important. And it really opens the doors. I think the patients realize, like, when you say, what questions do you have? They assume that they're not supposed to understand it all, and that they are supposed to understand, to ask questions to help them understand. And we've done some work in NICU research with looking at health literacy as compared to education and things like that. And I do agree that even the most educated parents at time, or patients, at the times that we're talking to them, be it research or any other time of a lot of information exchange and important information, it tends to be these really high stress situations. So even if they're incredibly health literate, they still might not be health literate right now. And so as part of what I do in working with our fellows in their research, part of what I do is meet with them as a group and then individually as they're getting their studies started, to teach them how important it is to do Teach Back, and not only at the exact time of consent, but also if it's a study that's ongoing or a study where we're getting consent now, but the actual study activity might not happen for a few weeks, to go back and reteach, because the recall, sort of as I think it was Mia was saying, the recall is really low. It may make sense to them right now, but a week from now, we can't assume that they can remember what we told them. Even though they understood that, I still think we have to, that this Teach Back is like an ongoing process throughout their stay in the hospital. So I'm really glad to hear that you're presenting this, and I think it should be presented everywhere to every audience at Christiana, even if, no matter what the role is.
We're trying.
It's great. Thank you.
Yeah.
Thanks, Amy. I think, for us who are in research, I think it's so incredibly important, for any time there is a consent to be administered, that we ask the patients, to make sure that, to repeat or to tell us what they understood.
Yeah, there's a whole branch of health literacy research and recommendations around research consenting. The key part of consent is the informed part, right? And that's something that, historically the health system has just drifted away from in terms of process and legalese and things like that. So it's good to have advocates like you out there trying to ensure that that's not lost.
I think, do we have some pediatricians in the audience? How do you do Teach Back with children, with teenagers? Or Greg, do you have any advice on that?
No, it's the same. That's why I kind of joked at the outset of this that if you don't directly interact with patients, you can try this out on your family. You can imagine, anything in your life, if you wanted to verify that your kid understands what you just said, have them do Teach Back, right? So the practice and the skills are the same. It's just, the phrasing might be even more simplified. The prioritization, getting those key points might be a little bit different. So, but the basic concepts, I think, are the same. And the key factor there, I think, when it comes to kids is the inclusion of the parents, right? And making sure that all three parties are on the same page, and that there's not a misunderstanding, that the kid understands one thing, but the parents understand something different. And that's the same thing that you were trying to communicate. That's where that caregiver piece really comes into play. And the same goes for the other end of the spectrum. The national data on health literacy shows us that with an aging population, right, as you get older, your health literacy level is likely to get worse, right? The percentage of people that are in the lower categories of health literacy increases dramatically over the age of 65 and certainly over 75. So for that population, it's again, like Mia and I going with our parents to doctor's appointments, it's extremely important that they have a support person who's receiving the same information, who's participating in teach back, because that person is going to need help navigating all of this.
Absolutely. Any other
I know
questions?
I blazed through the presentation, so we have lots of time for questions, so hopefully I didn't go too fast in that.
Oh no, this was perfect. All right, so I
Anybody
don't
else out there?
see any other questions. Everybody knows about teachback.
Yeah. Now is the time to practice. That's the hard part.
Right. All right, well, thank you so much, Greg, and thank you for this wonderful presentation. And
Yep.
we'll talk next year, I
Yeah,
guess.
anyone can reach out if they want more information. I'm happy to help connect anything that people need, resources or whatnot.
Great. Thank you again.
All right.
And
Take care,
thank you
guys.
everyone for attending the seminar.